This
have an
conference will now be recorded.
eminent speaker and clinician, Dr. Srinivas Datar sir. He is currently he is currently working as an assistant director at Integrated Cancer Treatment and Research Center, Dadar Center run by BSG Trust. He has been in active participation in international conference, camps and Ayurveda medicine promotional exhibitions. Also worked as senior research fellow at Integrated Cancer Treatment and Research Center run by BSD Trust since May 2009 to October 2011. He has presented various research papers in state level, national and international conferences on Ayurveda uh, wi- and cancer. Also actively participated in cancer research project and AIDS research project of the BSG Trust. He was invited as a guest speaker on the topic Cancer and Ayurveda in the memory of Padma Bhushan Vaidya Shiva Sharma organized by Mumbai Mahanagar uh, Ayurveda Sammelan. He was a president at Vaidu Parishad held at Vikramgarh tribal area of Thane district in 1997. He has written articles published in Yuva Sakal, Kalyan Nagarik, Yoga Shakha, and various Ayurvedic magazines on various subjects in Ayurveda and Yoga. He has delivered honorary lectures for diploma courses on Yoga and Ayurveda of Tirak Maharashtra Vidyapit, Pune. He has delivered honorary lectures for certificate course on Yoga run by Arogya Seva Samiti, Panvel. Also delivered many lectures on awareness about cancer at various places in Maharashtra. He has kept his career objective to be recognized as expert in every area of Ayurveda since Ayurveda science, treatment, drug manufacturing, and plantation. To contribute and learn professionally on each assignment and grow along with the organization. With this brief introduction, I request sir to start his session. Please start. Thank you.
Good afternoon, everybody. First, first of all, I must thank organizers to give me an opportunity to present our views in front of you. Just 1 minute, I could not go further. पुढे नाही जात. Some technical problem. I cannot change slide. Is this visible?
Sir, it is visible. You can.
Okay.
Yes.
I will not go for full screen.
Okay.
Okay. If this is visible, then I will not go for full screen.
Okay, sir.
Yes. This is our Bharatiya Sanskrit Darshan Trust Integrated Cancer Treatment and Research Center, Wagholi, near Pune. It is recognized as a center of excellence by Department of Ayush, Government of India, and also supported by Department of Atomic Energy, that is DAE, for Radiotherapy Department, and also affiliated to Cancer Indian Cancer Society. We'll directly go on the topic. So Ayurvedic treatment, how it works. Ayurvedic treatment brings doshas and dhatus in equilibrium with the help of Shamana Chikitsa. Secondly, it detoxifies body to prevent recurrence with the help of Panchakarma Chikitsa, that is Shodhana Chikitsa. Then it treats local inflammation or ulcers with Shashti Upakrama. then enhances immune system with the help of Rasayan Chakitsa, then nourishes body and maintains health with the help of Pathyakar Ahar Vihar, that is diet regulation. Then it boosts up morale of patient with samupadeshan, and finally prevents recurrence with Nidana Parivartan. But today we will deal only with Shamana Chikitsa and Rasayan Chikitsa. See, what is treatment? Treatment is working on each and every Samprapti Ghatak. Factors which are included in Samprapti, treatment acts on them and make equilibrium of doshas. If there is dosha dushti is there, then we can use drugs for to bring all doshas in equilibrium. In Dhattvagni Mandya, especially when we are speaking about cancer, especially Rasa Rakta and Mausa Dhattvagni Dipan, drugs which are doing Rasa Rakta and Mausa Dhattvagni Dipan, such drugs are important while treating cancer. And the Dhatu Balya treatment is also required. Then, when there is Dhatu Gata and Dhatu Paka Avastha, then Pitta Shamak and Rakta Prasadak drugs are required. While treating Ojo Vikruti, Rasayan Chikitsa is important, and for Srotodushti or Khavaigunya and Vishishta Avayava Dushti is there. Then also Dhatu Balya and Sroto Balya treatment is required. We are using commonly used preparations in various pharmaceutical forms. We are using single herbs like Ananta Churna, Gokshur Churna, Amalaki Churna, herb mixtures, that is Mishra Churna, that is Hingvashtak Churna, Trifala Churna, also Sitapaladi Churna, some Gugul Kalpas. These are examples, not all the drugs are included in this. Trifala Gugu, Chandraprabhavati we are using. Sugar for in sugar based kalpa, Shatavari, Ananta kalpa we are using. In Asavarishta, Kumari Asav, Pipalya Asav we are using. In medicated ghee, Yashti Madhu Gruta or Trifala Gruta we are using. In Rasakalpa, Yakrut Plihodarari Loha or Suvarna Malini Vasanta or Raupya Suvarna Suchekar. Also Suvarna Bhasmadi Yog, that is our preparation that is used while treating cancer. We'll go for two kalpas. First is Yakrut Plihodarari Lohavani. Reference is Bhaishajya Ratnavali. There are total 5 varieties of Yakrut Plihodarari Loha are described in text. Out of them, below mentioned variety is chosen as it contains Suvarna Bhasma, Raupya Bhasma, Suvarna Makshik Bhasma, which are having Rasayana and Vishaghna property. This is Yakrut Plihodarari Loham in Bhaishajya Ratnavali. Swarnam Raupyam Tatha Tamram Vangam Cha Abhram Samakshikam Sarvardham Jaritam Lohai Kalpayet Kushalo Bhishak. स्वर्ण रौप्य ताम्र भस्म वंग भस्म अभ्रक भस्म सुवर्ण माक्षिक भस्म, ये सब समभाग लेना है. उससे आधा सर्वार्धम चारितम लोहम, लोह भस्म जो है वो उससे आधा लेना है. शृंगबैर रसेन अपि शेफाली दलजै रसः स्वरसैः बिल्वपत्राणां क्वाथैश्च कटुतिक्तजैः रसेन बहुमञ्जर्यां भावयेच्च त्रिधा त्रिधा. Trituration is made by Shrungabearers, that is Ardrakaras, Shefali Dalajayirasi. See, Shefali is a synonym of, we found two herbs which are known as Shefali. First is Parijatak and second is Nirgundi. We are using both. Swarasai Bilva Patrana. Bilva Patra Swaras कटुतिक्तजयी क्वाथैश्च. कटुतिक्त का क्वाथ, किराततिक्त का क्वाथ. रसेन बहुमंजरिया, बहुमंजरिया यानी तुलसी, तुलसी का स्वरस. And all these were the three trituration, three bhavana per drug are given to these bhasmas. वल्लमात्रं प्रदातव्यं पर्पटक्वाथसंयुतं प्लिहानं यकृतं श्वासं कासं च विषमज्वरं गुल्मशोथोदरानाः अग्रमांस अरोचकं कामलां पाण्डुरोगं च चिरकालानुबन्धिनं सर्वान् रोगान् निहन्त्याशु वातपित्तकफोद्भवान्. This is Granthukta reference for यकृत प्लिहोदरारी लोह. सुवर्ण भस्म 1 तोला, रौप्य भस्म, ताम्र भस्म, वंग भस्म, स्वर्ण माक्षिक भस्म and abrak bhasma. All these 6 bhasmas, 1 tola each. Then loha bhasma ardha matra, that is 3 tolas, that is 30 grams of loha bhasma is used. Then these are bhavana dravya. As I said, ardraka swaras, 3 triturations per drug we are giving. Ardraka swaras, that is fresh juice of ginger. Shefali dala swaras, as I said, fresh juice of nirgundi leaves and fresh juice of parijataka leaves. Then bilva patra swaras, fresh juice of leaves of bilva. Then kiratatikta kwatha, decoction of kiratatikta. And last bhavana is tulasi kwatha, decoction of tulasi. Why trituration is given? To increase potency of medicine. It directs medicine and helps it rapid uptake towards affected organ. That is gamitva. You all must know about gamitva. See, we'll go later. Dosage is valla matram. As we are using in this dose 125 mg BD. It is used in following diseases, mainly in plihodara and yakrutodara. Then Shwas, Kas, Vishamajvara, Gulman, all that are written in Shlok. We'll see properties of contents. First is Suvarna. Madhura Rasa, Shitavirya, Madhura Vipaka, and Suvarnavasma is a Snigdha. It acts on Pandu, Kasa, Jvara, Shwasa Kruchrata, Bharakshay, Atisar. That is also Rasayan Dravya. You can use it in all the diseases. रौप्य भस्म कषायाम्ल शीत मधुर स्निग्ध लघु can be used in ज्वर क्षय कास पांडु अरुचि. Then ताम्र भस्म, it is तिक्त कषायाम्ल उष्णवीर्य मधुर विपाकी तीक्ष्ण और सर है, ज्वर कास अग्निमांद्य उदर शूल जातोदर and यकृत शूल. Tamravasma is having tendency that is affected towards yakruta, that is liver, and also is bhedana or sara. So you can that Tamravasma acts on dosha sanchay in yakruta, and with the help of sara, that that pitta is getting direction towards uh, antra, or towards its natural direction. Nvangavasma is tikta, kashaya, lavana, उष्णवीर्य कटु विपाकी वृक्ष गुरु है, कास छर्दी श्वास कृच्छ्रता में उपयोग होता है. इन सुवर्ण माक्षिक मधुर तिक्त कषाय अम्ल शीत मधुर लघु है, पांडु और अग्निमांद्य में उपयोगी है. अभ्रक भस्म मधुर शीत मधुर विपाकी स्निग्ध, ये भी पांडु ज्वर श्वास कास उदर अग्निमांद्य जठर शूल इसमें उपयोग कर सकते हैं. लोह भस्म तिक्त कषाय रसात्मक शीतवीर्यात्मक मधुर विपाकी वृक्ष गुरु है, पांडु प्रतिश्याय कास श्वास ज्वर उदर शूल भारक्षय छर्दी, अतिसार और यकृत शूल में उपयोगी है। लोह भस्म भी यकृत की तरफ जाता है। These are bhavana dravya of Yakrut Plihari Lohavati. First is Ardraka, is कटु रसात्मक उष्ण वीर्य और मधुर विपाकी है। तीक्ष्ण रुक्ष गुणों का है। छर्दी, काश, श्वास, शूल, विबंध, आनाह और उदर में उपयोगी। निर्गुंडी, दैट इज तिक्त कषाय कटु है, उष्ण है, कटु विपाकी है, लघु गुण का है और कास, शूल, शोथ आध्वान में उपयोगी है। पारिजातक कटु तिक्त है, उष्ण वीर्य का है, कटु विपाकी है, लघु है, ज्वर और कास में उपयोगी है। बिल्व कषाय तिक्त कटु है, उष्ण है, कटु विपाकी है, लघु तीक्ष्ण स्निग्ध गुणों का है, प्रवाहिका ज्वर अतिसार में उपयोगी है। किरात तिक्त तिक्त है, शीत है, कटु विपाकी है, वृक्ष और लघु है, ज्वर कास श्वास शोथ में उपयोगी है। तुलसी कटु तिक्त है, उष्ण वीर्य का है, कटु विपाकी है, तीक्ष्ण उष्ण है और कास श्वास में उपयोगी है। We will see mode of action of these bhasmas in Yakrut Plihari Lohavati. स्वर्ण और अभ्रक भस्म है, that is increasing rasa dhatu agni. Actually स्वर्ण भस्म is acting on all धातु अग्नि मांद्य, all the रस धातु अग्नि मांद्य, रक्त धातु अग्नि मांद्य, in all धातु अग्नि मांद्य you can use स्वर्ण भस्म. रौप्य भस्म, लोह, ताम्र, that increases रक्त धातु अग्नि mainly. सुवर्ण माक्षिक जो है वो रक्तवर्धन करने वाला है एंड गिविंग स्ट्रेंथ टू रक्तधरा कला. रक्तधरा कला इज सिचुएटेड इन लिवर इन यकृत which helps in formation of रक्त धातु फ्रॉम रस धातु. ताम्र भस्म यकृतगामी है. ताम्र लोह रौप्य प्लीहागामी है. रौप्य भस्म जो है वो सिरागामी है. यकृत के सन्निध जो सिराएं बताई हैं, टोटल आई थिंक 40 सिराएं बताई है, जिसमें से 10 तो यकृत के नजदीक रहती है, वो सिरागामी है रौप्य भस्म. सुवर्ण, रौप्य, वंग, अभ्रक और सुवर्ण माक्षिक जो है वो रसायन गुणों का है और सुवर्ण, ताम्र, लोह, वंग, अभ्रक और सुवर्ण माक्षिक जो है वो विषघ्न बताया है. रोल ऑफ हर्ब्स ऑफ भावना द्रव्य. आर्द्रक और बिल्व जो है वो जाठराग्नि दीपन करते हैं. बाद में किरात तिक्त और तुलसी है वो रक्त शोधन करते हैं. पारिजातक है वो यकृतगामी है. निर्गुंडी है वो प्लीहागामी है एंड आर्द्रक जो है वो भेदन गुणों का है. तो ये these see when we take any drug, what happens, first action is of that bhavana dravya. So then there is action of that main bhasma or other churnas and all that, but first action is of bhavana dravya because it coats all molecules of a drug. That coats up, outer coat is of bhavana dravya, so it first it acts with the help of bhavana dravya. Then Jatharagni, Jatharagni Deepan is more important because all the bhasmas are guru that are very heavy to digest. So Jatharagni Deepan is necessary. So there are Ardraka and Bilva is there as a Bhavana Dravya. Then Yakrut Gami and Plihagami, Parijatak and Nirgundi takes all the drugs towards Yakrut or Pliha, and then these bhasmas acts on Yakrut and Pliha. Kiratatikta and Tulsi's Rakta Shodhan that reduces impurities from Rakta Dhatu and Rakta Shodhan takes place. See, mode of action is mostly all the bhasmas in this kalpa are Shita, but Bhavana Dravyas are Ushna. And due to Ushna Guna of Bhavana Dravya, rapid and easy uptake of the medicine towards Yakruta and Pliha is possible. Mostly, all the bhasmas are acting as prasadana and rasayana on these organs. So Yakrut Plihodharari Loha gives strength to Raktadhara Kala, which is situated in Yakrut. That increases Rasarakta Dhatuvagni and improves formation of Rasarakta Dhatu. It gives strength to the organs such as Yakrut and Pliha due to its Rasayana Karma. And Yakrut Plihodharari gives strength to Siras for improving circulation of Rasa and Rakta Dhatu. So, as a whole, Yakrut Plihodharari Loha acts on Yakrut and Pliha, and it acts as a Rasayan Kalpa in carcinoma of liver or hepatocellular carcinoma or cholangiocarcinoma. It works as a Rasayan Dravya. Then we'll go to another Kalpa, Atharva Suvarna Bhasmadi Yog, ASBD. There is Anubhavik Yog, Suvarna Bhasma 20 mg, Muktik Bhasma 125 mg, and Guruchi Sattva 250 mg. Suvarna Bhasmadi, we are preparing in our pharmacy named as Atharva Pharmacy. So that is Atharva Suvarna Bhasmadi Yog. Again, Suvarna Bhasma is Madhura Shita, Madhura Snigdha. It works on Pandu, Kasa, Jvara, Atisara, Shwasakruchrata, Bharakshaya. Moktik Bhasma is Madhura Kashaya, Shita Virya, Madhura Vipaki, Laghu, and Snigdha. It works in Daha, Kasa, Shwasa, and Bruhana. गुडूची सत्व इज कटुतिक्त उष्णवीर्य मधुर विपाकी लघु ग्राही दीपन and it works on Daha, Prameha, Kamala, Jwara, Krumi, and Rasayan. So this Atharva Suvarna Vasmadi Yoga is mainly Rasayan. Why Rasayan treatment is important in cancer? Because cancer is a disease which occurs again and again. It spreads in it can spread in other organs in your body. If you go for if cancer is detected and a patient go for surgery or conventional treatment like surgery, chemotherapy, and radiotherapy, if patient has taken all the three, then also it can occur again, maybe recurrence or metastasize. So at that time, Rasayan Chikitsa is very important, which works on all the dhatus of your body, and it don't allow cancer cells to grow. So Rasayan Chikitsa is given to can be given to all cancer patients. This formulation can be used in Grahani, Amlapitta, Pandu, Kasa, Jirnachvara, Dhatukshaya, Rajayakshma, बुद्धिक्षय अपस्मार स्नायु दौर्बल्य हृदरोग विष मानस विकार प्रमेह and rasayan. So we have done one study in some patients of breast cancer. Total number of patients is 76 of all stages and grades were treated with Atharva Surna Vasmadi Yoga, and these patients are divided in three groups based on duration of treatment with ASBD formulation. First group is treated for 1 to 2 years. 37 patients are included in this group. Then group 2 is treated for 2 to 4 years. 33 patients are included. And third group is treated for 4 to 6 years with the help of ASBD. And 6 patients are included and in that group 3. What is assessment criteria? For assessment of general health, see, this treatment is given after conventional treatment or along with conventional treatment. So assessment of general health and tumor burden is made with the help of biochemical parameters like hemogram, liver function test, kidney function test, or some tumor markers. That is CA 15.3 is a tumor marker done in carcinoma of breast. For secondly, for assessment of survival or longevity, IU, and cancer status, that is disease free survival, which is known as DFS, and overall survival, that is OS, with the help of radiological examinations like mammography, PET scan, CT scan, abdomen, CT scan of chest, abdomen, pelvis, sonography, X-ray chest were taken into consideration. Time points of for assessments are: time point A is before starting treatment of ASBD, and time point B is at the end of treatment of ASBD. See, in very shortly, I have uh, analyzed these patients, and I am directly going to results. Disease status of patients according to radiological investigations. We'll go for that. Disease free survival is seen in 81% of patients in group A, that is, who have taken 1 to 2 years of years treatment of ASBD. Then 76% of patients are having disease free status. What is disease free status? In we have seen a previous slide, disease free status is uh, DFS, that is disease is not found in radiological examinations. Okay, in mammography or PET CT or CT, there is no disease occurred, and 66% of patients from group 3, these 66% of patients are having disease free status. Then we have seen disease progression in only 19% of patients in group 1, 15% of patients in group 2, and 17% of patients group 3. And disease regression, we have seen 9% in group 2 and 17% in group 3. So from this table we can say that disease regression and disease free status, it can be made possible with the help of Rasayan Chikitsa. And survival patterns of number and percentage of patients in different stages treated with ASBD in three groups. See, this is group 1. In that we have divided in stage 1 cancer or stage 2 cancer. Here stage 3 cancer and stage 4 cancer. Like that in group 2 and group 3. So 5 to 10 years survival is seen in 13% of patient of stage 1 or 2 of breast cancer, and 3% of stage 3 and 4 of breast cancer. Then 12% of patients are having 5 to 10 years survival. The 12% of patients of CA breast stage 1 or 2, they are having survival of 5 to 10 years, and 16% of patients, they have survival of 5 to 10% from group 2 stage 3 or 4 breast cancer. In group 3, 33% percent of patients are having 5 to 10 years survival, and these 33% of patients are from stage 1 and 2, and 67% of patients are having 5 to 10 years survival, and they are having stage 3 or stage 4 CA breast. Like that, uh, we can say more you take, more time you take Rasayan Chikitsa, your survival is more. We can say like that. So while concluding, we can say Rasayana activity of ASBD helps in improvement in quality of life, disease control, and increase in survival period in cancer patients due to enhanced anti-inflammatory, antioxidant, and immunomodulatory effect of this unique combination of Ayurvedic medicine. We have uh, we have filed a patent for this combination, an international patent and national patent also, and we have published also that patent. We'll see in brief relevance of Rasayan Chikitsa in pathogenesis of cancer. Why Rasayan Chikitsa is important? Rasayan Chikitsa can work on factors involved in the samprapti of cancer, that is अग्निवैगुण्य, धात्वग्निवैगुण्य, दीर्घकालीन धातुक्षय, ओजक्षय, and Garavisha, that is due to Viruddhahar, or we can say along with chemotherapy and radiotherapy, mainly chemotherapy, that is also a type of Visha. So we can give Rasayan Chikitsa along with chemotherapy or after chemotherapy. Then Vyasana Hetu. Vyasana is opposite properties of Oja. So Rasayan Chikitsa also acts on Vyasana Hetu. Again, side effects of chemotherapy, Dhatu Vaishamya, Dhatwagni Dushti, and Ojakshaya takes place when chemotherapy is induced. So Rasayan Chikitsa also acts at that along if it is given along with chemotherapy. Then what Rasayan Chikitsa is doing? That is Agni Vruddhi, Ojo Vruddhikar, Hetu Pratyanik, and Ojo Vruddhikar and Bala Vruddhikar. These are Rasayan Chikitsa, how Rasayan Chikitsa works. Rasayan Chikitsa also immunomodulation. All Suvarna Bhasma, Guduchi or Muktik Bhasma, mainly Suvarna Bhasma is immunomodulator, Muktik Bhasma is anti-inflammatory, and Guduchi also is immunomodulator. So this combination works as a immunomodulation, and it prevents recurrences or metastasis of cancer. So we have formulated such a combination like Suvarna Bhasmadi Yoga, and is working as a Rasayan Chikitsa and gives very good results of quality of life of patients is improved. And the if we go statistically, it says that more you take that Rasayan Chikitsa, your longevity is also increased. Thank you very much. I again thank organizers to give me an opportunity to present this presentation in front of you. Thank you.
Thank you very much, sir, for this uh, elaborative session on drug designing in oncology integrative approach. If anybody is having question, you may ask in chat box.
See, use of bhavana on dhatu gamitva. As I said, bhavana dravya, when we administer any drug, firstly bhavana dravya acts, and then other contents, maybe bhasmas or maybe churnas. So if bhavana dravya is yakrutgami or plihagami, then that takes all the these drug towards that organ, and that other contents work on that organ. Use of anupan is also same. Anupan we can anupan is that which increases properties of that drug and which helps in digestion of that drug. It's almost same properties of bhavana.
Any more questions? If, if there is no question, we may conclude this session. We'll wait for 2 minutes. I think no question is there. You can conclude this session. Thank you, sir.
Thank you. Thank you. Thank you very much.
Thank you.